Hi, welcome to Your Health Matters. I'm Scott Kern. Do you have chronic pain? Have you ever seen a physician for that chronic pain? If not, have we got the guy you want to meet today? We have Dr. Paul Yamaguchi, KRMC's pain management specialist. Today he's going to talk to us about his programs and what he's bringing to KRMC now to help you with your migraines and other pain issues. So stick around, it'll be a great show. We'll be right back. Hi, welcome back to Your Health Matters, and I'm Scott Kern. Today, my guest is Dr. Paul Yamaguchi, our pain management specialist. Welcome, doctor.
Thank you. Thanks for inviting me.
Hey, thanks for being on the show. I know you've got a lot of great programs you're going to talk to us about today, but before we get into those programs, we need to talk about you. I mean, people don't realize the background you have and what you bring to KRMC, so if you don't mind, let's spend a few minutes talking about how you got here and how you've been helping KRMC for at least as long as I've been here, which is 6 years.
Right.
So let's start with easy questions. Give me your background.
I started getting involved in both research, diagnosis, and treatment of pain in 1982. And I've been involved with that progressively, and in 2007 I came here to KRMC, and with the help of a colleague we started the pain management program at KRMC in 2008, and it's progressively grown, gotten bigger, and I'm excited about being able to offer new techniques, new treatments, and be able to help the community because, as you know, everyone's got some pain somewhere, sometime.
Everyone's hurting somewhere, absolutely.
Right.
So you guys have built this in KRMC from the ground up, essentially, from where it started in 2008 to where you're at today.
Correct.
You've had your fingerprints all over it, and that's a pretty cool process to kind of watch your own baby just grow and evolve over time.
Exactly, yeah. It's been very exciting to be part of the team that is bringing new things to KRMC and to the Kingman and Mojave County
area.
Absolutely. Exactly, yeah.
So I guess what got you interested in pain management? Were you in medical school and figured this is a great research area, or, let's talk about medical school first. Where'd you go?
I went to the University of Colorado, and
so you're Buffalo.
Totally.
There you go. That's
go Buffs.
If I wasn't going to be a Sun Devil, I wanted to be a Buffalo.
All right.
That was one of my favorite schools to go visit.
Yeah. So it seemed like a natural progression because, as a physician, medical school, you're learning about diagnosis and treatment, and the most common complaint that people have is pain. So I focused my efforts on learning about pain, learning how to diagnose different sorts of pain ailments and treatments, and just working on honing my skills throughout the years. So it's been a progress, and I've really been very happy with being able to offer things to patients that previously were unavailable.
So did you go to medical school at the University of Colorado also, or did you go somewhere else for your medical school training?
Right. No, I completed my medical school training at the University of Colorado, and then I did my residency at Johns Hopkins in Baltimore.
That's pretty prestigious to get to Johns Hopkins.
Yeah, yep. It was an excellent experience, excellent training experience, and I think at that time, even now, it's second to none in terms of the overall educational process and training process.
Absolutely. I know the KRMC is part of the Mayo Clinic Care Network.
Right.
Which is a great program for the hospital to be involved with, but we can't overlook other hospitals that we've been able to attract doctors from, like yourself, because Johns Hopkins it's worldwide famous.
Absolutely.
That's a great program to be a part of, so we're lucky to have you from there too.
Well, yeah, I'm glad to be part of this system here.
So you trained at Johns Hopkins, you got your undergraduate and your medical school completed at the University of Colorado, and I guess tell me about some of the experiences you've had with pain management. Let's talk about that. Through your journeys because you've been practicing for over 30 years.
Right.
So I'm sure you've seen quite a bit of advancement in your field. How did it start in the basic levels to where we're at now? How different has the treatment varied?
I guess one experience that really comes to mind was while I was in training. So I'm a board-certified anesthesiologist, and then I did a fellowship training in pain management. While I was in the fellowship for pain management, we had a pain clinic that was on the 5th floor of the hospital. And so the secretary would set up appointments for patients, and they'd come in. And after a while, you kind of get a feel for patients, the type of patients that seem to be frequent flyers, so to speak. And I probably presumptuously made some assumptions about kind of patient types that was stupid on my part. So a patient had called in and they said, well, the 5th floor, that's going to be kind of hard because I don't take elevators. So the secretary relayed this information to me. I don't take elevators. And I kind of categorize this patient as kind of another
frequent flyer.
Yeah, an eccentric patient that is demanding. They know what they want, what they don't want, and they're going to come in and just say, you know, they're calling the shots, so to speak. So, you know, patients like that, for the most part, they shouldn't even go to a doctor, because if they want to control everything about their treatment and care, they're not going to be responding to anything that professional may be suggesting.
That's an interesting point.
So anyway, the guy, okay, so we made arrangements for having special transport services to bring him upstairs. As it turned out, so my thoughts were, this is going to be this type of patient? No. Turned out that the guy happened to have been in an elevator, was on the 11th floor, and the cable gave out, and the safety cable on the elevator gave out, and he sustained his painful injury by 11 floor drop in an elevator.
Oh, wow.
And crushed his pelvic bone, crushed his knees, crushed his ankles. And so, rather than making assumptions based on what a person kind of on face value brings to the table, I don't do that anymore.
It's a life lesson. At least you learned that early. That's the important thing.
Right.
Yeah. And we only have one set of floors here. We have a 2-story building where you're at, so it's
That's
okay.
True.
There's not 11 floors here.
That's true.
So let's talk about some of the programs you have here at KRMC. I know you do acupuncture.
Yes.
Now, is that your main primary focus on the pain management, or what are some other practices you have in your clinic that you use on patients?
Right. Well, my main focus is to try and get away from traditional medical management using narcotics and opioids, because you got to face it, we have an epidemic that is basically killing our country with narcotics, and a lot of narcotics are initially given for good reason, but they're prescribed, and then once the prescription is over, patients can get hooked on it, end up going into street drugs. And I mean, we've seen overdoses time and time again.
So you're working to kind of get people off the pain medication before they get addicted to it.
Exactly.
That's not a bad deal to have at all.
Right.
So when you say you get away from the traditional, which is, we'll say, pain meds at this point, what do you do as far as, and like I mentioned, acupuncture? Are there any other things that you do tend to work with patients on?
Right. Well, any alternative. So physical therapy, adjustment therapy, massage therapy, different electronic devices such as a TENS unit, which is a transcutaneous electrical nerve stimulator.
So how does that work?
The theory behind it is that by interfering with the pain pathway that's developed, let's say, from a finger, painful injury that is just chronic and unrelenting and resistant to medical management, that pathway from the injury or injured area or the nerves travels up the arm into the spinal cord and up the spinal cord, traveling to the brain to register as pain. So the spinal cord stimulators or the electrical nerve stimulators can interrupt that pathway So the signal coming from the painful area is scrambled, so by the time it reaches the brain, it's muted. And that's kind of the theory. It's part of what we call the gate theory of pain, which has been, pretty well proven. It's not like totally accepted across the boards, but it's a very, thought to be a basic part of what we consider happening in that situation.
Well, that's great. I mean, that's a cool process for us to have. We're going to take a short break, and we're going to come back and talk about another new feature you have at the pain management. It's your Botox migraine treatment.
Yes.
Okay. You brought a guest with us to talk about this today. So
exactly.
After the break, we're going to come back. We're going to talk to Dr. Yamaguchi about Botox and migraines. So stick around. We'll be right back.
So they found that the only ones that this really worked on was people with chronic migraines, and chronic migraine, by that definition.
Hi, welcome back to Your Health Matters. I'm Scott Kern. Today we're talking to Dr. Paul Yamaguchi, our pain management specialist. And Dr. Yamaguchi, today you brought along a friend of ours, Camille. Camille, she is our demonstration today for your new program. So before we start to talk about your program, let's talk about Botox for a second. This is not Botox in the traditional sense that pop culture has given us to believe in, that it's to help with the looks. This is to actually help with pain, correct?
Correct.
So I guess, why don't you walk me through how we use the Botox with Camille and tell us about this process and program you have.
That sounds good. So anyway, as background, Botox is a specific derivative from a toxin that is elaborated by Clostridium botulinum, which is what causes botulism. Botulism was first described in the early 1800s, and the actual bacterium was isolated in 1895. It wasn't until the 1960s and 1970s that they started utilizing Botox for things like squint and spasms of the eye, and in 2002 FDA approved Botox for use of plastic surgery,
for
taking care of
purposes,
cosmetic lines and helping relax muscles. So it operates by relaxing muscles. However, that's not the mechanism that we feel is going on when we use this Botox treatment for chronic migraines.
So what causes a migraine?
Migraines are still somewhat of an unknown in terms of exactly what causes it. We know that what does happen is a wave of neuron activity takes place in the brain, and it causes changes in the caliber and flow inside the blood vessels. So typically a migraine is a throbbing kind of pain, usually one-sided, sometimes both sides, usually starting behind the eyes. And there's 4 phases associated with migraine headaches that characterize the typical migraine. There's a prodromal phase where a person 24 hours before the migraine may have a sudden surge of energy or a sudden loss of energy. They feel fatigued, they're played out. Appetite may change. They're craving something unique, or they completely are nauseated and can't eat anything. Thirst increases, and sometimes people will end up urinating more frequently. So that's part of the prodrome phase, and people that are really tuned into their bodies will frequently be able to identify that. Then there's the aura phase, which comes usually shortly before the headache, usually an hour or two before the headache, and that may manifest as a change in appetite, nausea. Sometimes people will actually vomit, and visual changes where they'll see flashing lights, sparklers, zigzag lines. Actual hallucinations sometimes are described. And then there's the actual attack phase where the headache is just excruciating, and most people experience some element of either extreme nausea, vomiting, light sensitivity, sound sensitivity, and just even some smells may trigger a bad reaction during that phase. And then there's the after phase where people are just kind of, the next day they're confused after a migraine, and they're feel like they're played out, their energy level is down.
It's a pretty big deal.
Right.
People get, I get them every so often, but I didn't realize there's that much to them. I just always figured it's a bad headache. I don't really look at the science behind it.
Right.
So show us on Camille here how the Botox treatment works.
Okay.
Yeah, let's do this.
All right.
It's my first ever demonstration on the show. It's like a milestone.
Right. So this is specific for certain patients. Now, I see a lot of patients that come to my clinic with headaches. Okay, but that's the big set. Now, narrowing that down, there's only a small, not a small, but a substantial amount of patients that actually have migraine headaches. So that has to be sorted out. And then for this treatment, they have to be considered chronic migraines. Okay, so when they did the studies with this treatment, they took all headache types, and they found that the only ones that this really worked on was people with chronic migraines. And chronic migraine, by that definition, is 15 or more days per month with a headache, and at least half of them have to be of the migraine variety. And they actually ended up with really good results using this treatment for that specific subset of patients. So anyway, we use the Botox, okay, and it's a very tiny needle. I mean, I don't know if you can see that or not, but it is
about an inch long, maybe, if that.
Yeah, I mean, the length is very small, but the actual caliber of the needle is a 29 gauge, and so that it's barely a little bit bigger than most acupuncture needles. So the procedure is tolerated by people very well. The downside, what I need to express, is it's 31 injections in one sitting. Okay, so 7 different areas in the body and 31 different injections. So it's only a tiny amount that's injected. So from there to there, it's 1/10 of a milliliter, and that's what's injected into each one of these spots. So what we do is have the patient sitting, clean off the area, make sure that there's no bacteria on the skin that can be introduced through the needle, and then the needle is placed into one of the trigger areas, check to make sure it's not in a blood vessel, and then injected. So there's 3 across the top here, 4 across the top here. On the side, there's 4 on each side. And on the back, 3 along this muscle, 2 in this segment, and 3 in this segment on both sides. So that accounts for the 31 injections. And
how many times does a person have to get these injections?
It's recommended not any more frequent than every 12 weeks, so every 3 months. And the expectation and the outcomes have proven very good. When they ran the studies, they found that headaches were reduced over a 12-month period of time, so a series of 3 to 4 of these sets of injections was able to take the frequency and intensity of the migraine headaches down by over 50% in 70% of that select group of patients. So it's a very effective technique, and it has proven to be very useful in treating chronic migraine headaches.
Yeah, it seems like that this technique, you said it's a very painless needle as far as that goes. It's not a very big needle gauge-wise,
right.
So there's minimal pain to it. I shouldn't say it's painless,
right.
There's minimal pain
exactly.
to it.
That's a good point.
So you're essentially getting 31 shots every 12 weeks in one sitting, but the upside is your migraine should be relieved for that 3-month period.
No.
No.
It just starts ratcheting down. Actually, after the first set of injections, most people are not too impressed. So the first set is just kind of gearing the body up to be able to respond to the injections. We believe that that's what's going on, but for some reason the first set in a lot of people is relatively unsuccessful. But thereafter, each progressive treatment seems to improve in terms of the intensity and frequency of headaches.
So you have to give it time to work, essentially.
Exactly.
So don't be upset if it doesn't work right after the first injection.
Right, especially after that first set, because it seems like, oh my gosh, I just got shot all over the place 31 times, and I'm not really any better. But coming in, as long as the patients understand that that's almost a normal expectation, and if they do get relief, which happens frequently as well, then that's just bonus after the first one. But patients do come back if they stick with the program, and the success rate has been consistent with the original studies. So based on evidence, medicine, it is an effective and safe treatment.
It's a really impressive program to have, especially have here at KRMC. I don't think I've ever actually heard of Botox being used in this manner before, especially to help relieve something as painful as a migraine. Because if you've ever had a migraine, I mean, they're debilitating.
They can be, absolutely.
I know when I get them, it's not very often, it shuts me down. I am down for the count. So, if you get those, you said chronically, it's 15 times or more a month?
Exactly. So
to get them more than 15 times a month, they should definitely come talk to you about this program, because this is something that you need to try.
Right.
So are you taking new patients right now?
Yes, absolutely.
And taking new patients, so if a patient wants to come see you because they're having migraine issues or other pain management issues, they can call 928-263-3600, and that's your office line.
Yes.
And so since you're taking new patients, they can get you scheduled to come see you, because this is something that I think the community needs to hear about, and we need to get this out to the entire county too, because this is a fantastic program to have. I mean, how long have you been doing this here at KRMC?
I've been doing it since 2013. The original approval came in 2010 for this technique, and I'm not the type of person that jumps on the newest treatments that come out. I want to make sure that there's some safety built into time-tested procedures. So I waited a few years before I started doing that technique. However, my background and training in anesthesiology was a natural fit for this kind of treatment, because I've been delivering medications into muscles using small needles, big needles, acupuncture needles for all my career.
All right, so let's talk about side effects real quick. I know we're getting close to the end of the show, and there's a lot of information we have to get out here. So what are some of the side effects of the Botox treatment?
The most common side effect is neck pain. So patients following the treatment will notice tightness in the muscles that were injected in and around the neck, and that's listed about 6.7% of the patients that have that. Some drooping of the eyelids may occur because the medication may drift into the muscles, affecting the raising of the eyelids, and that occurs on the order of 5.5%. And then some facial paralysis occurs on the order of about 3.3%, but it's not tremendous. It's not like your mouth is drooping or your...
It's temporary.
It's a temporary, right, and there has been no permanent irreversible damage that's ever occurred with this treatment, which has been proven at least for 5 years now.
Cool. That's fantastic. It's a great program. And once again, if people want to talk to you about this or get an appointment to see you at the KRMC Pain Management Clinic, the number is 928-263-3600, correct?
Yes.
Absolutely perfect. Doctor, thank you for being on here today. We appreciate it. Camille, thank you for being on. You've been a lovely guest. Hope you guys are welcome on the show whenever you want. It's been a great show. Thanks for watching Your Health Matters. We'll see you next time.